welcome back to Live with Jane and Jody. It is September 20th, 2022, and this is it, guys. This is our last episode before the fall 22 class begins here at what's going to be Sonoran University. As of today, we are still Southwest College of Naturopathic Medicine, but on the day that you guys embark on this journey for sure, we will be known as the Sonoran University of Health Sciences. And that is what our topic is going to be about today. I'm going to introduce our special guest. We're really going to go into what that transition means with our president. So thanks again for everybody joining us. I'm sure you guys know by now, but for those that don't, my name is Jane Voorhees. I'm one of the admissions representatives, helping you guys get ready for a successful interview and join our community here. I've been at SCNM for a cumulative total of 9 years. I was here from 2007 until 2013. Got to take a short fun break and go off and play in live events, Super Bowls, concerts, all kinds of sporting events. I'm a live entertainment junkie. That's my outside of SCNM life. But then I got to come back to SCNM here in 2019 and really just dive right back into this opportunity to help you guys become the best that you can be and change the future of our healthcare. So it's great to be with you today. That's enough about me. One last note, please, as I started out, we are recording this session, so definitely turn on your cameras, engage with us. Feel free to unmute yourself when you have questions. We actually want you to do that, or even better, you're absolutely welcome to use the chat bar as well. But we want your participation and engagement with us today, so thanks for joining us.
All right. Hi, everybody. Thanks for joining us today. So as you probably already know, but if you don't, I am Jody. So I work very close with Jane. I work with the beginning of the alphabet. She works with the end. I was able to work with Jane when she was with us before. And then when she came back, it continued being a great fit with her on our team. So I've been with SCNM in August. I just celebrated my 16th year. So absolutely love what I do. I can't imagine being anywhere else, and to take part of this great Sonoran University that we're getting ready to embark on is just an amazing experience for me. Been out here in the Valley since 2002, so 20 years, absolutely love it. I came from the Midwest, and people ask, why did you move to Arizona? And I said, the weather. That is pretty much it. So welcome. Thanks for joining us. I hope you have enjoyed these live with Jane and Jody. I know we have, so it's been a fun time with all of you. So welcome, have fun. All right, on that, I always share a core value. Remember, core values are beliefs of our organization. So this time I chose, we achieve excellence. Here at SCNM, we are constantly striving for excellence and are always looking to improve not only our curriculum, but our teaching method as well. We also do whatever we can to improve our community that we live in. So that's one of my favorite ones.
Achieving excellence day after day as we transition into a university. I think that's a big
absolutely
telltale sign that this is where we belong. Yeah,
yep.
Good. That's a great choice for today, Jody. Thank you.
Thanks.
Speaking of excellence, all right, ladies and gentlemen, let me introduce our special guest today. Our president and CEO, Dr. Paul Mittman, will be joining us. Actually, I do see him. He's here. He's here. All right. Perfect. So let me tell you a little bit about his background, and then we'll just dive in here. So let me get my notes over here so you guys can hear some really exciting tidbits about Dr. Paul Mittman, a naturopathic doctor, also has education doctorate degree as well. He's been here at Southwest College of Naturopathic Medicine since January of 2000. He originally got his naturopathic doctorate degree at National College of Natural Medicine. So when he graduated, it also was a college. They also have now transitioned, are known as National University of Natural Medicine. So we are on a similar journey. After practicing in medicine for 25 years, 12 years in private practice, and then 13 years here at SCNM, Dr. Mittman also obtained his doctorate of higher education management from the University of Pennsylvania. He has received the President's Award from the American Association of Naturopathic Profession. He was the Arizona Naturopathic Medical Association Physician of the Year in 2000 and the AANP Physician of the Year in 2007 as well. Continues to lead by example. His energy is wonderful, which you bump into him, you see him around campus. He's quick to engage, always has a smile. Just definitely leads by example through a healthy diet and an amazing athlete. He is an avid cyclist. And that's a pretty good background. Welcome and thank you for joining us, Dr. Mittman.
Thank you so much. Well, it's so nice to see all of you. And if it's okay, if you're able to, I would love to, if you could turn your cameras on, just so we could see each other and say hello to each other. And I've had the pleasure of working with Jane and Jody for many, many years. And hopefully we'll be back to in-person interview days so we could do our interview lunches. That was something I always looked forward to, because having an opportunity to meet each of you is special for me for two reasons. Number one, you are the future of healthcare. And the second, for me personally as a naturopathic physician, you guys are the future, the next generation of a profession that I've spent a really long time. It's been 40 years. And so, it's just wonderful to see people who, share the same, not just the same commitment and dedication to humanity, but also a passion for naturopathic healthcare and all of the wonderful modalities that go into that. And so it's just really a pleasure to see all of you guys. And I'm just looking at your names here, and so I can see each of you. So thanks. So yeah, so yesterday, I don't know if you guys were on campus yesterday, but yesterday we saw signs coming down. And it was funny because it was kind of it was like a little bit bittersweet, because SNM, you could see in Jody's background, you could see that's in the Lim Commons. You can see the SNM; those are gone, and they're they took the signs off of the tops of buildings. And so in one place already, we've seen Sonoran University of Health Sciences, which looks really cool. And it's one thing to change your name, but it's really, I think, the most significant change in there is the C to a U, going from Southwest College to Sonoran University. And so I just want to, and I don't want to make this a presentation, but rather have a conversation with you guys. I'm here, I don't know if you could see a little bit of the background. I'm at the Virginia Piper Charitable Trust. And Virginia Piper was married to the founder of Motorola. And so they're the largest foundation here in Arizona. And we're here with our development, which is fundraising, staff, and several trustees, because the Piper Trust puts on these academies several times a year. And this is the first time that they've done one in person since COVID. But we have a board of trustees who are outstanding, and they're here primarily to learn more about fundraising, the board's role in fundraising, which is important. I think this year we gave out, I think, about $180,000 in scholarships. And so I think one of our goals, especially among the board, is to continue to fundraise for scholarships, because it's a way that we can help our students progress through the program with with more resources and a little bit less debt. But when you think about like the difference between a college and university, let me just ask you guys, for undergraduate school, how many of you went to a college? And raise of hands, versus how many of you went to a university? So it looks like, is there anybody who went to a college and not a university? Okay, so Susan said that she went to both. Okay, so Susan, what was which college and which university?
That's a really good question. So I did, can you hear me okay?
Yeah, now we can hear you.
Oh, good. Okay. So I did my bachelor's from Arizona State University on the West Campus here in Arizona. And then I did my post-bac, which was 3 years after ASU at Paradise Valley Community College.
Okay, great. And Gurpreet, same at the same schools too?
No, actually, I went to Bellevue College in Washington and Bastyr University in Washington.
Oh, nice. What did you study at? Did you get your bachelor's at Bastyr?
A bachelor's of herbal science.
Oh, well, great. And was there anything that you would say that you noticed a difference, college versus university?
Yeah, resources wise, there's a lot more resources you can find at a university compared to a college.
Okay. Yeah, and I think for Susan, it's a little bit different because community college is sort of a different, kind of a different category than a four-year either college or university. So some of the things that that we're looking forward to are more interprofessional education. And so, with the addition of the nutrition program, we're also working on a new program that I'm not allowed to talk about yet. But with the addition of the nutrition program, we now have students who are enrolled in the Doctor of Naturopathic Medicine program, and students in the nutrition program are able to take courses together. So there might be electives. So I think one of them is a nutrigenomics class. We also have another nutrition program called Nutrition Business Leadership, which is kind of part the science of nutrition, part the business of the natural products industry. And so there are also courses that our students in the Doctor of Naturopathic Medicine program can take in either of the two nutrition, and then vice versa also. And that's really important because I think, there are doctors who can have like a very broad portfolio of patients and modalities to draw upon. But even for those, I would say that collaborating among health professionals is really the key to both effective patient care and successful practices. Because, if you think about people's healthcare now, or the conditions that people are dealing with today, pandemic aside, we lead. Hi, thanks.
Sorry, can I grab you a box of lunch?
Oh, thanks so much. Someone from the school down there.
They've got it for you?
Yeah, thanks so much.
All right.
This is I'm at the Piper Trust. And those of you who are from Arizona would know Virginia Piper, because you see the Virginia Piper Cancer Center, the Virginia Piper, all kinds of things around town, and they're very, very nice. Well, at any rate, but interprofessional education is also a way to foster the skills to collaborate with other health professionals. So it could be with other naturopathic doctors. It could be with medical doctors or osteopathic doctors. When I was in practice in Connecticut, I was really good at manipulation or doing adjustments, manual therapies for spinal adjustments and soft tissue work. But I joined a practice where I had so many chiropractors who were referring me patients that it really didn't make sense for me to continue doing something that wasn't really my specialty. But I ended up collaborating a lot with those folks. Another example here in the Valley is we have on our campus, we have the Neil Reardon Center for Regenerative Medicine. And we started that when we built the Limb Commons in 2015, because it's an interdisciplinary approach for people with chronic pain, to offer them solutions that are non-opioid approaches to chronic pain. And so, what are some? Well, I don't want to make it Socratic experience all the time. So we have naturopathic doctors there. We have a chiropractor. We have a anesthesiologist, pain specialist or interventionalist. We have acupuncturists. We have a nutritionist from the School of Nutrition. We have a naturopathic doctor who focuses on mindfulness. And so when you put all of that together, you're giving patients an opportunity to, really get not just the treatment, but the assessment that they need. Because, especially for pain, when you think about pain, you think about, like, usually there's some kind of injury or some kind of stress that contributes to it. But it turns out that so much of how people experience pain has nothing to do with, like, the physical either disruption or injury or swelling that you could see either on your physical exam or on your imaging, because it's how they process pain. It's how they eat. Are they eating a diet that is inflammatory or anti-inflammatory? Are they getting enough sleep? Are they moving, just to move in general? Are they exercising so that not only does that benefit, in terms of from a cardiovascular standpoint and disease prevention standpoint, but also are they having the emotional and the endorphin response from exercising? So you put all of that together, and that is a much more successful approach to helping people with chronic pain. And it's kind of like it's a little like a microcosm for how you guys are going to practice as naturopathic doctors in the future, where, it's better to be integrated into the healthcare system than to be kind of on the periphery. When I started, I graduated in 1985, and I remember, at the time, I don't remember I can't think of an ND who was working with a medical doctor in the same practice back in 1985. Now it's very common. You have NDs working in hospitals. You have NDs working in federally qualified health centers or community health centers. And so having that kind of exposure as part of your education is really important, because I think it just prepares you well for the career that you're gonna have for decades. So that's one of the biggest things about going from a Southwest College to Sonoran University. The other thing, and being here at Piper, is really serendipitous in this conversation, because Piper has been a big supporter of some of our community health programs. We have been involved in community health since 1996, providing free care in medically underserved communities around the Valley. That's what we call the Phoenix metro area, the Valley. We've been working with the HIV and AIDS community since 1997, with people dealing with substance abuse disorders since 1996. We have 2 school-based clinics. Hamilton Elementary School just celebrated its 20th anniversary, and in the Roosevelt School District, we opened a clinic in 2017, and then we have been at a domestic violence shelter called Sojourner Center since, 16 years now. And so being here at Piper is really interesting because we're in a session where we just happen to be, there's 6, we learned today to not use the word nonprofit anymore. The new term is social profit. So that way, if someone asks you, if you work at what is usually called a nonprofit, it's kind of a misnomer because you can't be unprofitable and still stay in business. And there's a lot of connotations that go with nonprofit. On the other hand, social benefit corporation is, what does that mean? It means that you work in an organization that does good for society. And so it just so happens that one of the other organizations that is here at the table right next to us is Phoenix Rescue Mission, where we have been, is one of the community centers that we work at called Changing Lives. And they've just invited us to open a second clinic with them. Changing Lives is for women, and we'll be opening a second one for men in this next 6 months or so. So that's the other thing is, I think the idea of a university is more expansive. And when you think about, like, for all the things that we've done, working in these different communities, you only get to address like a sliver of the determinants of health that affect whether people are healthy, whether that they have access to food or clean air, emotional, how are their needs being met on an emotional level. And so the next level for us is to develop more of these partnerships, so that I think we'll be starting something in Tempe in the next year as well. And I'd like it to be something where it's a collaboration with other organizations that can bring, different perspectives and address more of the determinants of health. And then I guess I'll just say one last thing about where we're going. I don't think Jody or Jane have been on. We started a committee called the Student Success and Persistence Committee. There's a term in higher ed called retention, which is, how do you retain and then graduate students, which is a measurement for the institution. But as students, the idea of retention is kind of irrelevant. It's really about succeeding, about persisting, and about graduating. And so in this committee, we've been looking at a whole body of new literature, research literature in higher education on how to foster student success. And Jody and Jane work in student affairs, is the kind of the overarching department that admissions falls within, along with advising, financial aid, registrar's office. And for years, the idea of retention, has always been kind of centered in student affairs. So advising, we have learning specialists, and ways to support students. It turns out that the home of retention, persistence, is equally important to be in the classroom. And so we have been kind of delving or diving into the literature, and we've created this committee that includes people from student affairs and also our faculty and academic affairs, to really look at, well, what are the best practices to make, to create the best environment for students to succeed and to thrive. And I kind of, at the core of this, and this is what I'll leave you guys with, is the idea of a growth mindset. Deficit mindset is the opposite of that, which is like, well, these are our standards, you're going to be doctors, deal with it. Growth mindset is that if in your interactions with Jane and Jody that you get through the application process, and then you make it through the interview, which always includes, and I'm pretty sure about this, at least one faculty member. And you get into the program, then it's a shared responsibility. You have to do your part, but we have to do our part. Because if you get into the program, then the assumption is that you've got what it takes to make it through and to become a naturopathic doctor. And the idea of a growth mindset is how do we work together to create the sense of belonging, so that you know that you not just belong here, but you belong in the profession. And what are the different things that we can do, starting with the syllabus itself, which seems like a kind of a dry document. But there are a lot of really interesting things. What do we do to make sure that faculty get to know something important about you, and not just so that they would know your name, but I think everybody who comes here for a very special reason. For some people, it was a personal health challenge, or maybe a family member. Maybe it was the inspiration of a doctor that you had, whether it's a naturopathic doctor or another kind of doctor, who either was a role model for you, or saw something in you that that could see that physician within you, that inspired you. And for us, the more that we know about you is a way for us to not just recognize or see or hear you, but to value and to incorporate your perspectives, and also, given the diversity of our student population, to be able to incorporate the healing traditions and the perspectives and the unique lived experiences that you each bring to the classroom and to the clinical experience. And so with that, I'm going to stop what my wife usually refers to as my monologue. And I would love to, hear, either if you have any questions, or, would love for you guys to share, just a little bit about yourselves.
Don't be shy.
And that's okay. You could be shy, and we could have like a mindful moment where we don't actually have to do anything in particular.
Well, I mean, I guess I'll break the ice.
There you go, Brittany.
My name is Brittany Lindsay. I'm 26. I live in Nashville, Tennessee. So I've been here for a while, and I will be moving to Arizona in 2 days. So I just packed up my whole car, and I'm just gonna go for it.
You hit mute by accident.
You're on mute.
Okay.
You're still on mute, Brittany. We can't hear you.
Oh, you can't hear me?
Now we can.
Okay.
We heard you say 2
The
days.
last we know,
You're hitting the
we
road.
know that
Okay.
you packed. We know that you packed your car, and you're not asking us to help you pack your car. So
Okay. Yeah,
You might need help unloading, right?
Yeah, I'm just gonna go for it. So 2 days, I'm really excited. Naturopathic medicine wasn't in my original plans, but I was just researching different naturopathic doctors that came out of Southwest, and just fell in love with it. And it's not just a job to them. They really embody naturopathic medicine as a lifestyle, and they love it, and they're thriving. And I grew to fall in love with it. I grew to fall in love with it. And I'm just super, super excited for what the future has in store. it's a huge transition for me. I have not stepped foot on campus or even ever been to Arizona. I'm literally in Music City, so but I'm ready for it. And so I believe when you have a goal and you have a vision, you just go for it. But yeah, just the core values that Southwest College of Naturopathic Medicine stands on just really stood out to me from any other naturopathic medical school in the country, and so I'm just really impressed and excited to be here.
Oh, okay. Well, we look forward to meeting you. How many days do you think it's going to take to drive out here?
Well, my GPS said it's over 24 hours, so maybe about after stopping to urinate several times, it's probably going to take over 30 hours.
You're going to drive straight through? Okay.
As many stops as it takes. My parents were super supportive, so my dad's like calling a trailer with all of my stuff. My car's stuff full of things. So as many times as we have to stop, we will, but it looks like we're driving through Texas, Arkansas, just a bunch of states. So I'll be there on Saturday to move into my new place.
Oh, good.
It's a long drive.
And you said your dad is coming too?
Yeah, he's literally just coming to help me move in, and they're driving right back on Sunday.
What a trooper.
Okay.
Oh yeah, I'm very grateful. My parents were super supportive. They've really been helping me along the way. So got a big drive.
Well, good. Well, I'll be on campus briefly on Saturday. So if you're there, I'd love to say hi to your. I'll see you, but I'll love to say hi to your folks.
Awesome. It'd be great to meet you. Yes.
Yeah. How many people are not from Arizona? Okay.
I'm from Florida, so I made that drive too. You
Okay.
can do it.
Yeah, Arizona is
drive from Florida. Yep.
Okay, I'm not alone.
Florida. Oh, great. Yeah, we moved here in '97 from Massachusetts, and Arizona is, and I don't know, Jane and Jody, you guys aren't from here either. It's definitely different. However, I would say that it's also within Arizona is really different, because you could drive 2 hours north and be in the snow and like around 0 degrees in winter. And if you're out by Flagstaff or up by the Grand Canyon, southern Arizona has a completely different feel. There's even a place called Patagonia, Arizona, which is about 20 miles from the Mexican border. There's mountain ranges all around the state. So it's a wonderful place to live. It is kind of different, I think, from everywhere else that I've been in the United States, but I have to say we love living here. And so I'm looking and see, we've got Iowa. Susan mentioned born in '97. Thank you. Thank you for reminding me that I was like already old when I moved here. I was 40 when I moved here. And let's say drove from Pennsylvania. Where in Pennsylvania? Let's see, that was
Daneshka.
Let's see, I'm looking for Daneshka.
Oh, sorry, I was trying to find the unmute button. Yes, I went to Penn State, so I came from State College.
State College, all right. Yeah, my wife is from Bucks County, which is outside of Philadelphia.
Yeah, I grew up in Florida, but went to Pennsylvania like primarily for college. So, but it was very much a long drive. But I also came out with my family, so they were very helpful.
Oh, nice. And let's see who else. Florida. So we have at least 2 Floridas, and we've got a Ohioan. And from SK, so Saskatchewan. Is that Victoria?
Yeah, originally I'm from Saskatchewan, Canada, but then we moved down to the States and we lived in Wisconsin. And then I went to school in California and Ohio. So yeah, my family's really supportive, but we move a lot, we drive. So
Oh, good. And what I'm trying to think, like, I know that there's Saskatoon, right? Saskatoon.
Yeah, Saskatoon. I was 2 hours from there. I lived in Swift Current. It's like 2 hours up from the border, so it's right above Montana.
Okay. Well, I was on the phone this morning with a gentleman from Calgary because in the newest building on campus is the Lim Commons. It's a really beautiful building, and the person who is he's a real estate developer in Canada, and one of our trustees brought him to the school one day for lunch, and he said to me, "What would you say if I offered $750,000 of services to get your building idea shovel ready?" And so that was Brian Marr, because Jane
Yep.
and Jody
Wow.
have met
Yep.
Brian.
Yep.
So the answer, of course, is thank you. And so that was the first of 3 projects that we ended up doing with Brian. I don't know, Jane and Jody, were you guys here when we did the? Remember they had it was like a fundraiser for ALS. It was called the Ice Bucket Challenge.
Yes, I was.
Did you do it? Did you do it?
I sure
So,
did.
Do you guys, not Jane and Jody, but the rest of you, have you seen that, the Ice Bucket Challenge for people with ALS? And so Jane, do you want it? This was Brian's idea.
Mhm.
So Jane, or Jody, I'm sorry, do you want to tell everybody what we use for a bucket?
It was, God, I don't remember, Dr. Mittman. I just remember that ice coming over my head.
So we were in the middle of building the Lim Commons, right? And so Brian went and got like a ton of ice, like maybe a ton of ice, and we used like a bucket loader, kind of like a bulldozer. They
A
have
backhoe.
loaders, like
Yeah.
a backhoe.
A backhoe, there you go.
Like that.
There you go.
And filled the entire thing with ice water. So there was like bags and bags of ice and then water. And, probably like 15 or 20 of us, got under it and
Yeah.
got the ice dumped on us, which was fine because it was the middle of summer, probably
Mhm.
110 degrees. And it was like, that was a pretty good.
Yeah, we have pictures somewhere.
Yeah, I know we have to do that. All right, and so I'm just looking to see, and I don't want to spend all of our time doing like geography, but it's fun to find out where you guys are from. So I see from California. From where in California? And who is this? This is
Alyssa?
Alyssa and Shamia. Is that the right way to pronounce your name? Shamia?
Shamia.
Shamia.
Yeah.
Shamia, where are you from in California?
No, I'm from Milwaukee, Wisconsin.
Oh, yeah. I was reading Alyssa's
Yeah.
and confusing the two of you. So Milwaukee, wonderful. Milwaukee just got licensed this year. Way to go.
Really? That's so exciting.
Yeah, for naturopathic medicine. That was a long time coming.
Yeah, definitely.
Oh, well, good. And Alyssa is from California. Let's see, Indiana born, raised there, and moved out here. And I'm here at Piper, and I did this I had a fellowship with the Piper Trust in 2010. And so I got to go to Indianapolis a bunch of times because they have the Lilly Center for Philanthropy. They had a fundraising program that I did there. And Brooklyn, New York. Lakita, where's Lakita? All right. So where are you from in Brooklyn?
I'm from East Flatbush. Are you familiar?
I am, because I grew up in Queens.
Oh my gosh.
Yeah, and I don't know if they still have that, but when I was a kid, we had like the best holiday of the year was Brooklyn Queens Day.
Yes.
They still have that? I think,
Yeah.
as a kid, I had no idea. I was like, wow, we get a day off from school. I think it was like a day for teachers to like plan or do something like that. But
We never understood the meaning either, but what mattered most was just a day off.
day off where there's like, you don't have to go, there's no religious obligation, there's no national, you don't have to go to anything. It's just like a pure day off for, you know, for kids, I guess.
Where in Queens are you from?
So I was born in Jackson Heights,
Okay.
and then lived in Flushing,
Okay.
and then lived in Bayside or Little Neck.
Wow.
Yeah, it
So
was
I
just
can
there.
already witness the transition for you.
What's that?
I can already understand the transition for you then.
Yeah, I left when I was, you know, I graduated high school at 17, and that was it. And people ask me if I miss New York. I love going back to visit, but I don't miss New York. And so let's see. All right, and then I see Dean has been in Arizona long enough that it's home. And do you live here in the Valley, Dean?
Yes, I live now I live in Gilbert, and we're moving close to being Central Mesa.
Okay, yeah, good. Yeah. When we moved here in 97, my wife drew a circle around the school, and she said, we're gonna live within a 5-mile radius of the school. So we actually live 3 miles from the school, but it's nice to be able to just kind of like zip to the college or the university, sorry. And
Yeah,
in a couple of
I'm
weeks.
about 10 minutes away, drive time.
Oh, nice. And in about a couple of weeks, I'll be able to ride my bike, you know, back and forth, which is a nice thing to be able to do. All right, good. Do you guys have any questions about the schools now that?
Yeah, I'm looking forward to doing that myself.
Oh, good. Do you ride a lot? I'm looking to see.
I don't.
Oh, okay.
I would actually have to get a bike. Yeah.
Yeah.
So,
Yeah, that's a prerequisite.
yeah, I run, I don't ride. So,
Okay. Yeah.
but running to school seems like it would take a lot longer.
And you
Yeah.
got those books.
Yeah, they call that rucking. You know, where you have a rucksack, people like put rocks and stuff in, they go ride around. It hurts my knees just to say that. I'm good.
Yeah.
You guys have any questions either about the school, about the future of the profession? Anything else?
I do want to ask, right? So all these states that you guys listed out here, I went through this list, and out of all the states you guys identified, 6 of them are currently not licensed. And you, Dr. Mittman, kind of mentioned that it was a long time coming for Wisconsin to get that licensure. What's it going to take for in 5 years when these guys are done and graduating and ready to start their own practice as well? How do we make sure that those other 6 states are licensed, or at least more are out there? What's your advice on that?
What can we do?
I'm sorry, did someone say something? I thought I heard somebody else say something. Well, I think, you know, a couple of things. First of all, the National Association, both in Canada and the United States, are actively working on licensure. And so I know that each year, you know, licensure is a multi-year effort, because number one, you need doctors who are going to practice in an unlicensed state, which for the most part is doable. You have to have like a certain risk tolerance, you know, to do that. And you need doctors because those are the people who are going to advocate for licensure. But even more important is that you need patients who want to have naturopathic medicine licensed in their state, you know, because for a profession to be essentially lobbying for licensure, you know, we're a special interest group along with all the other special interest groups. Patients, on the other hand, are pure constituents. And so you have to have 3 things. You have to have doctors, you have to have patients, and you have to have some kind of, trying to think what's the right word to call this, I don't know, if playing cards, it would be called a bridge, like a bridge, a trump card. So that would be like with a small t. Because in most states, there are much bigger forces that might not be interested in naturopathic medicine being licensed, or might even be imposed. So I remember we had, I don't know, do you guys remember Sam Price? She used to be Sam Robinson. Her aunt was the head of the chair of the city council in Washington, D.C., which is essentially the mayor of Washington, D.C. And I remember when naturopathic medicine was up for licensure in DC, it was her aunt who was really instrumental. It could be in California, it was a movie producer who said to the president of the California Senate, he said, and he was the number 1 donor to that particular party. And he said, if this doesn't get passed, there's no more donations from me. And so, it's you'd be surprised at how many things like that actually happen. So as students, it's about participating in events like the federal legislative initiative that we hold each year in Washington, or it could be just engaging with the state association in a particular state or province. And I'm a good resource for connecting people, but there's plenty of people at the school who are good resources to connect you to doctors in the states and this association. But I see both Susan and Lakita have raised their hands, and so I don't either one of you, whoever unmutes first, gets to say something.
I was very curious when you mentioned students, well, not students, naturopathic doctors, if they want to be able to have a state become licensed, they would have to be okay with practicing in an unlicensed state and having like a group collective come along with that. Have you ever seen SCNM students attempt to do that after graduating and either being successful or unsuccessful in the states that were originally unlicensed?
Well, I've seen people who graduate, go to unlicensed states and succeed in practice, and the state not get licensed. So I'm thinking of, you guys remember Sharon Stills, Dr. Stills, and then her son is Ben Stills. He's an alum also. So Sharon moved back to New York City, or New York, she was on Long Island. And to this day, New York is still not licensed. New York has a very dysfunctional legislature. And I could say that because I'm from New York and I was on the New York Association board for 10 years. But she had an amazing practice. I mean, it was, and I remember going and visiting, and she had a very broad scope of practice. Sharon has a very, when I said like a risk tolerance, Sharon's like, I'm gonna go out there, I'm gonna help people, and I'm gonna do what I'm gonna do, and whatever. And so she was very successful. Then on the other hand, I just got a text from Heidi Weinhold in outside of Harrisburg, Pennsylvania, where she went back, had a very successful practice, and she was really instrumental in helping Wisconsin get not Wisconsin, Pennsylvania get licensed. So yeah, and I think probably the thing to do is to connect with people who are in those states, and when you go home, on a break or for the holidays or something like that, you can get in touch with me or other folks at the school to connect you with some doctors who are in those states and get a head start before you graduate. Susan?
Sonora Community College wants to interview me since I got into the program, which is really awesome. And so I guess my question is, what would you guys want me to share in terms of letting community colleges who don't know a lot about NV, and of course, a lot of students who start community colleges don't really know a lot about naturopathic medicine to begin with. So I guess like I'm going to share my experience and of course my, you know, my whole story and everything, but what are key points that you guys would say would be really beneficial to share with them as people who are learning about it for the first time?
I think as naturopathic, once you become, once you graduate and become a doctor, my wife and I taught a class at a community college. We taught a class in Ayurveda. And so I think just having, whether it's, you know, teaching in class, doing a guest lecture, just being engaged, you know, with communities, and community colleges is a good hub for that. But there's lots of great opportunities to engage with community colleges, and I would say even high schools is really important.
I just feel like people, you know, community colleges like just don't know about the field at all. So like obviously they want, you know, this interview between me and them to kind of be like that eye opener because so many people don't know about it. So I'm like, I want to make sure that, you know, we can share those points. So a lot of people who might have not known about it who are now interested can kind of do what I did. So
Yeah, I think just sharing your own experience, especially as an alum. Which community college did you go to?
I did college.
I'm sorry, I didn't hear you say.
Community college or PVCC.
Okay, yeah.
Rose Valley.
So yeah, so I mean, I think just staying engaged as an alum is a great way to do that. And then I would say I see Jody and Jane both going like this. Yeah.
Before you go back, we'll be happy to talk with you and like help you
Yeah.
hit those key bullet points of, all right. And it starts with your story, Susan. Like, what is the factors that you saw difference in naturopathic medicine versus the traditional allopathic route? Like those are the key bullet points, but we'll definitely help you with the best bullet points and how to present it.
They just want to do like an alumni interview. So like basically like I'm sharing my perspective for their like alumni newsletter or whatever. I got the email this morning and I was like, okay, cool. I have more things to work on before I see you guys on Monday.
More pressure.
Okay. So Caitlin, and I see in the chat, Shoshana asked a question. Pennsylvania is licensed. So Pennsylvania, I think, is registered. I know that it's regulated. And they're still, and that's probably the text that I just got from Heidi Weinhold because she's from California. And they're working on the, after you get licensed or regulated, I'm not sure what the exact term is in Pennsylvania, you have a scope of practice and then there's a whole bunch of rulemaking. And they're in the process right now of finalizing, you know, some of the rules in Pennsylvania.
That would be amazing because I come from New Jersey and I love my family so much. They're all there. And I know New Jersey isn't even close to being licensed or registered, but if I could at least be close to them, that would be my goal because it is important to me and I love them. And that's all I have to say. So thank you for telling me that.
Yeah, for sure. Caitlin.
Yeah, thank you. So I was just looking at the naturopathic.org, like the licensure. They have a really good color coordinated map if any guys are wondering about it. But I was kind of confused what it meant, like bills filed or pending for licensure versus advocacy initiatives ongoing. What is the difference between that?
I'm not exactly sure, but I'm assuming that advocacy is pre-bill. Bills have been filed or you know, underway means that, you know, to have a bill, you need a sponsor in the House and on the Senate side. So for the bill to be introduced, you know, that means that they're, you know, pretty far along. The problem with state legislatures is that if a bill doesn't make it through in a given session, it's kind of like an Etch-a-Sketch where, you know, I don't know if you guys know what Etch-a-Sketch is, but it's like you start over again, you know. So every year in a state legislature or in the federal government too, when you introduce legislation, if it doesn't get passed and signed, you start over again. Usually, you know, people, you know, legislators hang around usually for a really long time, especially in state legislatures. And so, you know, if you've done a good job cultivating an advocate or champion in the House and in the Senate side, you know, they stick around and they'll reintroduce, you know, from one year to the next. It's really, there's a lot of things that go into it. Like I know in New York, and I don't remember, I don't know how much you guys have followed it, but like in New York, we've had 2 governors in the last 10 or so years who had to leave office because of various scandals. Governor Cuomo left not too long ago. And before that, he was really bizarre because he was like the attorney general and he was a big law and order guy, and he got implicated in like a prostitution scandal. And so I remember that year we were like so well set up. We had all of our sponsors, we had everything ready to go. And when that happened, it just threw the legislative session into turmoil. And legislative sessions in most states are like at most 6 months. And so, you know, the first thing that they have to do is pass the budget. And the closer you get to the end of the budget, the end of the legislative cycle, the less likely it is that your bill is going to get passed. And so that was a year that, you know, always sticks out for me because it was like we were so perfectly, you know, set up. And then New York, I think the Speaker of the House or the head of the Assembly, which is like the House in most states, he was arrested. Shelley Silver was arrested. I mean, it's just really bizarre. You know, the things that you don't expect to, you know, to influence, you know, something that, you know, that you're trying to do something good for society and for humanity, and then, you know, kind of weird things can happen. So are there ways students can engage? So yeah, so I know we haven't really had it during the pandemic, but here in Arizona, we have like a legislative day, so a lobbying day at the legislature. Legislators way more prefer to meet with students than doctors, because you guys are like the future, and a little bit less of a special interest group as far as legislators are concerned. The ANP also has a federal, it's called the DC Fly, the Federal Legislative Initiative. So they have something in the spring where students go to Washington, DC and go and it's actually very well planned out. So yeah, so there's plenty of things that you can do like that.
We are down to 60 seconds. I want to be very cognizant of your time. I'm so grateful that you stepped away from the meeting that you're at there at the Piper Foundation. Thank you so much. And lunch. We're starving you this afternoon. All right, so 60 seconds. Final words of advice, words of wisdom, preparing through the program once you're in ending. 60 seconds, go.
Okay. So my advice to you guys is that, like, and I've said this a bunch of times, it was like in A Tale of Two Cities. It was the best of times, it was the worst of times. Our job is to make the next 4 years some of the best experiences that you ever had and some of the hardest. And it is a challenging program. And at the same time, I would say some of the people who are in your class are going to be friends for the rest of your lives. I mean, it's really extraordinary that you're going to meet people who, as different where you come from, backgrounds and all kinds of things, you all share something very special in common. And I would just say, take care of yourselves. You know, don't do this, you know, I'm just gonna, you know, I'm going to do everything just for this, and I'm going to ignore my, you know, health and well-being. You know, it's a beautiful state to live in, and make sure that you get out and continue to do the things, that have helped you succeed and get to this point. And, continue to pay attention to what you eat, exercise, deal with stress, and then enjoy the ride, because it really is an extraordinary experience. And I would say, when I did the doctorate program at Penn, everyone said it was the hardest thing they ever did, except for me, because this was the hardest thing that I ever did. But it was also the best thing that I ever did. And I could say that because I met my wife in school, and so I could say that was the best thing. I don't get in any trouble for saying that. And Jane and Jody know Laura. So. Right. Well, it was really nice to meet all of you. I can't wait to meet you in person. And for those of you who are traveling or about to travel, safe travels. See you soon.